Good afternoon. First of all, we are talking here of combating antimicrobial resistance. Now, what is antimicrobial resistance? Antimicrobial resistance is one thing in which the bacteria change and become resistant to the antibiotic which are used in the animals for using in the infection that has caused by them. Now, this developed anti-resistance, drug resistance, can be transmitted to humans. Now, once this is transmitted to humans, which can be due to food, milk, or meat also. Now, this can go to the humans also by soil, by environment, or by air. Now, this spreads to the general public. Let's go to this second slide. Can you see the slide? Hello?
Yes, sir, I can see.
Yeah. Now, see, if you can see, combating antimicrobial resistance is a global threat. Now, once this is spread to the patient, what happens is patients, when he falls sick, he also develops the drug resistance. Now, when the patient falls sick due to, maybe unhygienic conditions, or maybe due to faulty management of the environment in which he is being kept, or uncleanliness in the majority of the cases. So once they go to once they go to the hospital, they are being treated by antibiotics. However, as they have already developed antibiotic resistance, the antibiotics are not going to have any effect on them. So as a result of that, the patients don't get better, and the conditions becomes more worse day by day. Now, this is a real global threat, because this is because of rampant use of antibiotics in animals. And this leads to emergence of this antimicrobial resistance in bacteria, which is transferred to human beings and causing a global havoc. Now, if you see it carefully, combating AMR is a major issue today. Why it is a major issue? Because this is because of the animal husbandry and the livestock, which is a major food producing industry worldwide. Now, in most of the cases, the gut health means, when I say gut health, I mean to say the health of the stomach is compromised due to improper nutrition and management. This results in poor growth, disease morbidity. That means chances of any disease being attacked or being got by the animals are increased, as well as the mortality. Mortality means the death in the animals. Now, to combat this, what is the best solution being used today is antibiotics. Antibiotics are widely used to prevent the infections which are being caused now. Let's go to the third slide. Now, why this is essential in case of dairy especially? If you see and if you have heard, of course you must have heard, that India is the highest milk production state worldwide. However, what we lack in, or what we are deficient in, is we are having very less number of milk per animal compared to others. Like in Israel, the average is 40 liters per animal. In India, I am ashamed to say it is not even one, because of the number of animals. We have the largest bovine population worldwide. Now, what is the cause for low productivity? To be very frank, I have been traveling throughout India for last 40 years. It is always due to very poor farm management practices. Now, why the farm management practices are poor is because initially, say before 2000, most of the farmers who were there were little illiterate. So as a result of that, they were not knowing things, they were not knowing science. And they used to look at their forefathers and do the business. However, today, what I see today is the children who have taken the business over are overeducated. When I say overeducated, what do I mean? I mean they were educated because of the use of Google, YouTubers and all that. And they get a lot of information which they are not able to identify which is the correct information, which is the wrong information. Because Wikipedia, in computers, what we use today, Wikipedia is only one source where everything is vetted for. However, in www, nothing is vetted for. If I am able to say anything on dairy, I am in www. If I say against dairy, I am still in www. But when a person is reading the things, he is not able to understand which is the actual thing, because no proof is given nor it is required. And if you go for dairy, you will see 1 million pages. So you will definitely not know what is to be read. So because of this poor farm management practices, what happens, it leads to a high bacterial load. You can see from the picture, see the animals, how they are, how dirty they are, there's no cleanliness, there's no hygiene there. So what will happen is there will be a high bacterial load present, and it will enter the intestine, enter the animals. And the only treatment is excessive use of antibiotics. Excuse me. So what happens is, there are two things which happen. The main thing is the financial burden on the dairy farmers is increased. You will be surprised to know last year, this is I think the figure of 2022, 63,000 metric tons of antibiotics were used worldwide. Now, what does the effect of antibiotics happen? This happens in the case of milk and meat. Milk through dairy and meat through poultry, and transfer to humans through consumptions. Now, so what happens now? Because of this, what has happened today in India, or I would say worldwide, more deaths than HIV or malaria or per annum. Out of the 4 million human deaths linked with antibiotic resistance, 1.3 million people have died due to resistant bacteria. Now, one of the major causes of this is mastitis, the most common disease of dairy animals. And this is very commonly treated with antibiotics. In fact, this disease is prevalent throughout the world, and the losses due to this are very high. For example, I'll give you a cow in its lifetime can give you at least 8 to 10 lactations. That means it can give 8 to 10 calves. Say it is given, say, for milk. What happens is, if it gets mastitis in the third lactation, the total loss in its life exceeds about 500,000 rupees. Is that bad a disease? But the farmers don't understand it. They don't take care of it in the initial stages. And when it occurs, when it is clinically, then only they go off for treatment, whereby they use very high antibiotics have to be used. Mind you, I am not joking nor exaggerating. They contribute 70% avoidable losses, which are with the milk production. Now, to stop this, there has been many regulations imposed worldwide. Regulations have been imposed on antibiotic growth promoters by agencies like European Medicine Agency, Food and Drug Administration, FDA in USA. India also initiated the same things. Like they have put treatment under antibiotics put under official surveillance to decrease this. And what would happen if the antibiotics are not used? What would happen is this. You can see the animal there. Now, because of the poor digestion, that means compromised gut health. What do you mean by compromised gut health? I am talking of compromised health of the stomach. Now, if the stomach is not proper, what will happen is it will not be able to digest any food. And since it will not be able to digest any food, the condition of the animal deteriorates day by day. What we see is now rise in this diseases. Not only that diseases, but other diseases too. Now, this we have to take a cognizance of this and work on this matter. What can we do? The best way what we can do is we can try for prophylaxis. Prophylaxis means prevention of things. We have to what you say you could the basic target regions or the targets can be prophylaxis. Second could be curb the rampant use of antibiotics. We can also shift to Ayurveda. We can go for ethnovet practices. We can use probiotics. We can use prebiotics. We can change the feeding habits. That means the habits of food which are being used today or which were being used earlier. But by taking science into picture, if we are able to change the feeding habits, it would be better. Then we can use nutritional supplements and we can change our total approach towards treatment. Now, what are the various things which can stop the use of antibiotics? This is probiotics, prebiotics, and symbiotics. Now, probiotic strains are gaining popularity and they are being widely used nowadays. In few cases, that means in many cases, what we can see, especially in poultry, there is a use of direct fed microbials, which is also used in the animal feed, as well as the use of probiotics to improve the gut health. That means to improve the digestion powers of the animal, we are using probiotics. Now, these probiotics and these DFMs are also acting as an alternative to antibiotics. They act as a growth promoter and they also control enteric pathogens. That means the pathogens which cause infection, the bacteria which cause infection in the body. Of course, not all, but some of them. Now, the probiotics are also used as microbial food supplement. Now, this will maintain the balance of the microbia in the rumen, and by virtue of which the digestive system is improved. Then these also act as immune stimulants. Mind you, they are not immune givers, but immune stimulants. And probiotic additives have been explored to improve everything. So, what are the various other alternatives available? Now, to be very frank, I would like to say that we have many various alternatives available, but most of them are in the research and development stage. For example, there is a lot of work going on nanoparticles. Of course, the nanoparticles have been used, but we are still awaiting the results of these trials as to how much they have been effective in curbing the disease loads. Secondly, the feed enzymes. Of course, feed enzymes don't have much of a work in ruminants, but they certainly have a lot of work and lot of improvement is being seen in case of poultry. So what is happening is the enzyme supplementation is improving the quality of feed stuff and leather of the livestock, which also results in a better profit margin. This is enzyme addition helps to produce more meat per animal. Of course, in the places wherein meat of the cows is also taken, this also improves there to some extent. And this is at a lower cost. It also improves the overall health of the animal. Now, because the health of the animal has been improved, what we can see or what we can notice is the veterinary costs have also decreased and the mortality rates also have gone down due to enzyme supplementation in the feed. Let's go to the next one. Various other therapies which are available for curbing this. Of course, like I said, I would say this once again, this is all under research and development and the commercial things are yet to come out of it. We have phage therapy, bacteriophages which act as natural antibacterial agents. They prevent the secondary side effects associated with antibiotic therapy. Then we have immunostimulants, substances that stimulate the immune systems, which enhances or improves the host immunity and the resistance toward the disease. Also, we have the immunostimulants which are directly enhancing the immune response because of activation of phagocytes, neutrophils, complement system, external activity, etc. Of course, like I said, I would like to say this once again. Let us not come to a conclusion as to how they have to be used because they are still constantly under the trial and error methods. Of course, we have cytokines also, we have antimicrobial peptides also. Now, what are cytokines? They are intercellular regulatory proteins providing good ability to communicate and conserve the cells with the orchestrated cellular behavior. Of course, this is, you would say, for our knowledge to understand what is coming henceforth in the world. Then at the same time, we have got antimicrobial peptides, which is having a host defense peptides, ubiquitously present everywhere. They are having a varied structural, functional diversity, a remarkable antibiotic proteins, etc., etc. So, now, what would be the most ideal method for curbing this antimicrobial residue in animals. Now, let me be very frank. I have been doing work in India for last 40 years almost now. I would say it is not 40, it is more than 40. What I have noticed is mastitis is the biggest cause of losses in dairy. The biggest. What is being seen is when it is starting, nobody notices that, nor they ignore it. Now, why this is occurring? This is literally the mastitis, I would say. I'm working in one cooperative in Punjab to curb this. I can safely say 5 years ago, the occurrence of mastitis in India was 5%. Today, it is more than 30%. It's not very alarming, very, very alarming. And let me tell you very frankly, you can quote me after that. After 5 years, this will be 50% unless we do something about it. Now, why this is occurring? Why mastitis occurs? The biggest reason is a lack of immunity. We have many scientists and all claiming about immunity and all that. But my observation for the last 40 years, working with more than 2,000 farms across India, has been only one. The only best way to prevent diseases occurrence is through a completely balanced feeding formulation. Now, what is balanced feeding? Balanced feeding is a proper combination of all the vital feed ingredients required to build the animal to overcome the deficiency caused by minerals and other things lost through milk, as well as improving the immunity of the animal. Now, the balanced feeding can safely be said as green grass, an effective combination of green grass, dry grass, concentrates, and a mineral mixture. Now, I can safely say, and I can always safely, I have concluded that the basic for all this, the basic cause is because of mineral mixture, because India is facing mastitis worldwide. Why mineral mixture? Why I am targeting mineral mixture? Because that is the only ingredient which is common throughout India. Other things are different everywhere. The dry grass is different, the green grass is different, the raw materials used during concentrate formulation is also different. But only one factor is common to all, and that is the mineral mixture. And that, according to me, I can prove that, is the basic cause of occurrence of mastitis to a large extent. Now, why I'm saying this is because there are two factors which are important, which help in improving the immunity of the animal. It is called vitamin E and selenium. Out of this, vitamin E is an antioxidant which everybody knows. However, it is this vitamin cannot cross the placental barrier. That means this vitamin cannot give immunity to the uterus nor to the calf growing in the uterus. Selenium is the only ingredient which is doing this. It can cross the placental barrier. If you observe today, most of the diseases in dairy are related to the uterus. For example, there is prolapse of uterus, there is retention of placental membranes, there are cases of milk fever, cases of metritis, we have delayed inhalation of uterus, we have calves which are dying within 2 months from birth, we have abortion cases, and we have got some cases where the dead cows are born. Now, all these things are related to uterus because uterus does not have any immunity due to lack of selenium. And the presence of selenium in any mineral mixture should be at least 100 mg, 100 mg per kilogram. And the presence of the vitamin E should be at least 250. Mind you, why I'm saying this? Because I can take you to a state in Maharashtra wherein I can show you at least hundreds of farms, 100 farms minimum, whereas there has been no occurrence of mastitis for the last 8 years. And when this bigger killer disease is not there, you can safely say the productivity will be very high. Secondly, what is being seen in India is most of the mineral mixtures, if you notice them and if you read the labels, they always say nutritional value. So what exactly you mean by nutritional value? I am sorry to say that I have not been able to get an answer from anybody using this term. What exactly do you mean by nutritional value? Actually, the mineral mixture should quote elemental value. That means the presence of the element to up to that level. In other cases where the nutritional is mentioned, what is being seen and what I have seen, which to my utter, surprise, is they are quoting that the iron is about 10 grams in one mineral mixture. Iron is not got in the universe as iron, it is got as ferrous sulfate. Ferrous sulfate contains only 10% of iron. They have quoted the iron is 10 grams, but they have put 10 grams of ferrous sulfate. That means in the actual mineral mixture, the presence of iron in elemental value is only 1.1. Unfortunately, this has led to a grievous thing. That means the mineral supplementation given to the animal is not proper. As a result of that, remember this thing, the number of lactations you should get should be at least 10 to 12 from an animal. Most of the places, 99% of the states in India, what I see, I visit almost all of them, have only 6 to 7 lactations. This is because the mineral supplementation has not been correct, by virtue of which the animal gives the minerals from its own source, from its own body, and as a result, when it stops, they stop giving milk. So what is important is we have to have a focus on the health management, especially of the udder and the reproductive organs, because any case related to uterus always goes into mastitis. There are many other treatments for mastitis, but I don't know how much they can be effective because they are quite expensive by that way. We have got that ozone therapy, we have got that, waves therapy and all that, too many, but it's too much expensive to time consuming. We should always focus on 90% on dairy management, not on treatment which costs 2%. So basically what I feel is, if you want to top the curve of this, would be a good use of a good mineral mixture, that too having an elemental values. Now this, I would say today why this is happening is, we have got an ABCD concept of animal disease treatment. A is for antibiotic, which is supposed to treat the animal. B complex is support to treatment. Corticosteroids is it's a steroidal therapy which will bring down the inflammation or the if there is the swelling of any part of the body, it will be reduced because of corticosteroids. And D is the dextrose is the last resort, which will give natural energy, neutral energy to the animal. So what we have to focus totally today on, better nutrition management, better gut health of the animals, which will help in reducing the disease outbreaks. We will have a dependence on antibiotics will be reduced, and one day we can have a zero dependence on antibiotics. So what I feel is, hum honge kamyab ek din, but kab is only when we follow all this. Thank you for being responsible for this, and it is our responsibility to do all this so that we are able to curb this disease which is worldwide. Thank you very much.
Thank you very much, sir, for a wonderful presentation. I'll move on to the questions now.
Yeah.
The first one is, what role do antibiotics play in dairy production, and how can their use be minimized to reduce antimicrobial resistance?
See, basically, the role of antibiotic is to reduce the infection which has been caused. Okay, the infection comes in the animal because of lack of immunity. Like, I will give you a simple example. When we are talking in our house also, if there is a small child, we always tell him, don't drink cold water, you can get cold, but we drink it. Now, do we take antibiotics to improve our immunity? No, we don't take. What we do today is we just eat the food properly. and we have a lot of immunity. So the basic thing is, for anything to curb this use, is have a balanced nutrition. I'll give a simple example. If we go to today to any metro cities, what we see is especially the kids going to the college are on the little on the obese side. Obese, they are not healthy. They don't look healthy. They look fat and obese because they're eating food which their tongue likes. Whereas I eat the food which is in the home, and I don't happen to fall sick. Whereas these people, the younger generation today, if you see that, what you can see is they fall sick on the slightest pretext. So curbing antibiotic usage is the only solution is having a balanced diet. I hope I have made. You want to be more detailed?
Sir, there is a following question also. I just read it out, sir. Are there alternatives, treatments, or preventive measures being explored to reduce the reliance on antibiotics in dairy farming?
The treatments are being used which are, say, homeopathic. They are also few related to Ayurveda. But very frankly, the results are not that what we expect, frankly. They are not that, because the basic idea of stopping usage of antibiotic is having a good antibiotic immunity or good immunity within your body, which is only got through a proper balance of nutrition, nothing else. That would be the most natural and ideal way to stop the usage.
Okay. What are the challenges faced by dairy farmers in adopting practices to reduce antimicrobial resistance?
I'll say it once more. I said it during the lecture also. What has happened is this mastitis is the disease which is found all across India. Now, all across India, the feeding patterns are different. Like in humans, in the dairy also, the feeding patterns are different. But there's only one common ingredient throughout India, that is mineral mixture. And that is basically a wrong mineral mixture is the serious cause for non-development immunity in the animals. Like I said, I would just request you one thing. Try to excuse me. Try to use an elemental value mineral mixture. On the top of the mineral mixture, it is written each kilo should contain elemental values of, not nutritional values of. Number one. Number two, you can buy any companies. I am not saying anything. I am not requesting you to use any company's mineral mixture. But I would like you to suggest you that, first of all, try to use a mineral mixture which has got this wording. Each kilo contains elemental values of, number one. Every component has to have certain value. Calcium, 300 grams, phosphorus, 100 grams, whatever. But if you want to find out which is the best among the lot, the most ideal thing will be to look at two things which should be definitely included. That is vitamin E, which should be at least 250 IU, international units. And the second is selenium, which should be minimum 100 mg. Today, I have seen most of the companies' mineral mixtures, no one contains more than 40 mg. That is because of a simple fact that they are very expensive. Selenium is expensive. So most of the people try to use the very less way, but it doesn't work at all. And try to avoid mineral mixture which has nutritional value. And I would suggest one more thing. Don't use any product on which nothing is written. Like we have many cases wherein we see this contains so and so, but the values are not written. I would request you, the farmer, don't use that product. Because in that case, what they do is they will use the one which is cheapest and a more quantity, and one which is highest in cost to a very less extent. And since nothing is written, you cannot challenge them. That is a big challenge. I hope I am clear.
Yes, sir.
Yeah.
How can advancements in technology and genetics help in combating antimicrobial resistance in dairy cattle?
I already mentioned them, but frankly, most of them are under development. See what happens is, unless the trials are complete and we get a concrete results, we cannot use any product. So I am not advocating more on that. But the thing which is in our hand, which is available today, worldwide, means India wide or worldwide for that matter, should be used.
Okay. Are there any regulatory measures in place to monitor and control antimicrobial use in dairy
Yeah, yeah.
industry?
In India is there. They are trying to monitor the antibiotic usage. They are trying to monitor antibiotic usage, of course. But what is happening is we have got so many people there, and then the industry doesn't work online. The veterinary dairy industry at least doesn't work online because most of the people are illiterate. They don't use computers and all that. So the actual data, getting the actual data is a big problem. But the government has tried to put. They also put a ban on taking of milk having antibiotic residue to a certain extent. That they have started doing that.
Okay. What are some successful case studies or examples of dairy farms effectively managing antimicrobial resistance?
And like I said, I will say once again, I can show you many farms near Kolhapur area where when we using an elemental value mineral mixture having more values of selenium and vitamin A, whereas there will be no occurrence of diseases for almost 6 to 7 years, and no mastitis for more than last 8 years. I can definitely show you. If anybody is interested, he can contact me. I can take him to those places. He can see for himself. That would be more ideal.
Okay, sir. I'll move on to the next question.
Yeah.
What role do veterinarians play in promoting responsible antimicrobial use in dairy farming?
This is a very difficult question. You put me in a difficult role. No, because what is happening is, as a doctor, frankly, as a doctor, he also doesn't want his patient to get all right, because then his source of income stops. That's a big issue actually, and that's frankly it's an issue. It is an issue. And what is happening is, a doctor is so busy today because of these sick animals, he doesn't get much time to explain what is happening. Secondly, to explain to people like how I have been explaining to people what is happening, what should be done, and all that, he should have known. Because see, I am also a veterinary doctor, but I went to up to almost 36 countries to learn about dairy management, by virtue of which I have been able to understand what are the things which we can do, by virtue of which the animal will not fall sick, because that is very important by way of farmer. Unfortunately, as a veterinarian, I was only taught how to treat a diseased animal. That means a diseased animal is given to me, I have made it better, that's all. But I have not been taught how to have a farm where there is no disease. And I mind you, you will be surprised to know the cost of this in the dairy farming is 90%, whereas the cost of treatment which every doctor is given is only 2%. So the doctors are taught 2%. And this is applicable not to veterinary doctors, also applicable to veterinary doctors, human doctors. You can go to your human doctor, ask him, "Sir, I don't want to fall sick. What should I do?" You take it from me, he will not be able to tell you. He will tell you, "Sir, madam, you are my friend. You come, I will treat you free." But he will not be able to tell you that how not to fall sick. So this is a major issue, in fact. I hope you understand what I'm trying to say.
Yes, sir. How can international collaboration and knowledge sharing help address my antimicrobial resistance in dairy sector?
I have my doubts. See, because what is happening is the total conditions of working of the farms in India and abroad are very different. See, abroad, like when I was in Israel, there are many farms having, the farm has minimum 1,000 animals. Can you believe it? In India, number of animals, the 1,000 animals farm in India cannot be even more than 100. See, almost you could say 80% of the farmers in India have 3 to 4 animals. So what is happening worldwide? cannot be applied to India, frankly. That's a practical situation. We can always talk on all that, how it could be done, how could not be done. But frankly, I have my doubts. Because the systems differ. Systems differ.
Okay.
Yeah.
Are there any economic implications associated with efforts to combat antimicrobial resistance in dairy farming?
No, on the contrary, if you are doing it, trying to combat it, it is very much cheaper. Because see, I will give you a simple example. If you get mastitis case, a cattle having mastitis, which is giving 20 liters. Now, these 20 liters will come down to 10 liters. That means your first loss is 10 liters of milk every day. Okay. Now, 10 liters of milk at the cost of say 30, 40 rupees, 30 rupees, 40 rupees, 30 rupees you take, it is 300 rupees. Secondly, the cost of treatment will exceed 5,000 rupees. And then even the animal is cured, it will not come back to 20 liters afterwards. It may stay at 14, 15 only. That means that 6-liter loss will be throughout the life. Now, rather than that, if he is using a good mineral mixture with all these values and all that, which will cost him 5,000 rupees over a period of 1 year, would be much ideal and cheaper comparatively. You got my point?
Yes, sir.
Simple. Because here you are using 5,000 rupees at one time and having a loss permanently throughout your life. Whereas you are using a good quality mineral mixture for a whole year, costing 5,000 rupees. That means that 5,000 rupees is spread over a period of 1 year, not at one time. And you are getting a better quality of milk. That is always better and cheaper. Unfortunately, people don't understand this. They feel that treatment is the king and by treatment will get better. See, we cannot improve by treatment. It has to be by habit, by management, by nutrition only.
Okay. How can consumer awareness and education contribute to reducing antimicrobial resistance in dairy?
It will definitely. It will definitely. But we should have the people who have in-depth knowledge of this. See, what is happening is government has got many schemes. But the people implementing the schemes, they themselves don't have any knowledge of that. That is a big issue I have been seeing everywhere. Like recently, I came across one gentleman in Uttar Pradesh. He said the government is now thinking, how do we have a capacity building in India when the veterinary doctors are only involved with treatment? They are not involved with management. What to do? Can you believe that? This is what is happening. So for giving the capacity building also, we need to have people who know the stuff. It's not that you can just read it on www and start giving lectures to people. Nobody will believe you. Like on www, it is written how to drive a car. Can you drive a car reading www? You are getting my point?
Yes, sir. Yes, sir.
Can you drive a car reading www?
No, definitely.
So that is what is happening. So we have to have people who should have in-depth knowledge. So only then the proper communication can take place and proper dissipation of knowledge can take place from people to consumer or the farmer for that matter.
Okay, sir. Okay. Thank you very much. We have now completed the round of questions. On behalf of agricultureinformation.com, we like to thank Dr. Chandra Kiran Sant for the talk and for answering the questions. I like to also thank all the participants in the meeting. This meeting will now be closed.
Thank you.
You're
Thank
most
you.
welcome, sir.
Thank you.